The BIOSECURE Act isn't just compliance. It's a kill switch on federal money, triggered by who's in your biotech stack. And here's the trap. You don't have to sell to the government to get hit. If your lab or your partner uses a company of concern, you can become ineligible. Because equipment and services means machines and cloud, software, remote support, data storage, data transfer. The dates might be 2026, 2028. But switching platforms can take several years, so the market will move before the rules do. In this episode, we'll discuss 4 moves: map your federal exposure, map your vendors, map your data, and set up monitoring so you have a real switch plan. Get out your notepad and let's get started.
All right, welcome back. Today we're going to talk about something that sounds like a niche Washington procurement rule. But honestly, it's turning into a board-level issue for life sciences, biotech tooling, and even research institutions that think they're not government-facing.
Yeah, no, exactly. And I'll confess, when I first heard BIOSECURE Act, I thought, okay, another acronym, another compliance memo. But the more you look at it, the more it's like, wait, this can reshape supply chains, and not in a gentle way.
That's the right instinct. It's not that the law flips a switch tomorrow. It's that it sets up a mechanism where federal dollars become conditional on who you source biotech platforms and services from, and how data moves through those platforms.
Which is basically, if you want to do business with the government or take government money, you're going to need to show your homework.
Exactly.
Okay, set the stage for us. What is this thing in plain English? Like, if I'm a CEO listening in the car, what do I need to know before I walk into my 9 a.m.?
In plain English, the U.S. government has created a framework that, once it's fully implemented, will restrict federal agencies from buying certain biotech equipment and services from certain companies of concern. And it also restricts agencies from contracting with or funding organizations that use those restricted providers in performing federal work.
So it's not just the government won't buy from them. It's the government won't buy from you if you use them.
That's the key. It's leverage by proxy.
Okay, and I'm hearing equipment and services, which I feel like that's doing a lot of work. Is this just like manufacturing, or is it broader?
It's broader. The definition is deliberately expansive. Think lab instruments, yes, sequencers, analyzers, but also components, accessories, software, firmware, and then services, data storage, data transmission, consulting support, even certain disease detection and genealogy adjacent services.
So if I'm running a research lab and I have a fancy instrument that comes with a cloud portal and a vendor does remote support, that's in play.
That's in play.
And if I'm a pharma company that outsources something, say process development or analytics, to a third party, that's in play.
Potentially, yes, depending on whether that third party is a designated company of concern, and whether the relationship intersects with federal contracts or funding.
All right, so the word designated matters. Walk me through that.
Sure, the law doesn't just list a handful of companies and call it a day. It sets up 2 pathways. One is tied to an existing Defense Department list. Think of it as a list of companies already flagged under a national security lens. The second is an Office of Management and Budget-led interagency process that creates and maintains a list of biotechnology companies of concern.
So there's a list today, and there will be a bigger list later.
That's right, and it will be updated, at least annually, potentially more often. This is not a set-it-and-forget-it compliance topic.
Okay, I want to underline something for listeners. If you've ever dealt with sanctions lists, export controls, restricted party screenings, this feels like that muscle group. But the difference is, this is procurement and funding, not just you can't sell to X.
Exactly. It's less about trade mechanics and more about eligibility for federal money.
Which is why universities and research institutes are in the blast radius too.
Yes, people think government contractor and they picture defense primes. But federal funding is everywhere in the life sciences ecosystem.
All right, let's talk timeline, because you said it's not flipping tomorrow.
Right. The law sets a staged rollout. First, OMB publishes an initial list within a year of enactment. Then OMB issues guidance. Then, the Federal Acquisition Regulation, FAR, gets updated by the FAR Council. And only after that do the prohibitions really bite, with different effective dates depending on the category of the company.
So we're talking 2026, 2027, 2028-ish, depending on how fast the government moves.
On the outer bound, yes. But here's the thing, and this is where risk leaders need to be honest. Switching biotech platforms can take years, and the market often front-runs regulations.
Okay, say more on that, because that's the part executives always underestimate.
Think about a lab instrument ecosystem. You don't just unplug one sequencer and plug in another. There's validation, training, integration with pipelines, data compatibility, Same with manufacturing services. Process transfer is expensive and slow.
And if you're in the middle of clinical development, you can't just wave a wand and change suppliers without a regulatory ripple.
Exactly. So even if the legal effective date feels distant, the operational runway is long.
And you said the market front runs it, meaning primes and partners start putting contract language in now.
Yes, you'll see representations, warranties. If you become designated, we can terminate. You must notify us if your ownership changes. And that's rational, because nobody wants to be the weak link that makes a program ineligible.
Okay, let's go one level deeper. What does ineligible look like? Like, what is the penalty? Is it fines, jail, or is it just you lose the contract?
The main lever here is eligibility. The agency can't procure from you, can't extend or renew, can't fund certain activities if you're tied to restricted providers. So the economic penalty is you lose federal dollars.
Which, depending on your business model, could be existential.
For some companies, yes. For others, it's only a chunk of revenue or a strategic growth channel. But the bigger story is secondary effects: investor perception, partner requirements, reputational risk.
And also, maybe just operational chaos. Like, we just found out a supplier is on a list, and now we have to scramble.
Yes, and scrambling is expensive.
Okay, I want to get really practical. If you're a COO, CISO, or head of procurement, what should you be doing right now? Not in 2028, now.
I'd break it into 4 work streams.
Hit me.
First, exposure mapping. You need an inventory of your federal touchpoints: contracts, grants, loans, cooperative agreements, and not just direct, but indirect. Second, map biotech equipment and service dependencies tied to those touchpoints. Third, map data pathways, where multi-omic data or sensitive biological information flows, who has access, and what vendors are in that chain. Fourth, build a designation risk monitoring process for key counterparties.
Okay, that sounds simple. In practice, it's messy.
It's messy because the equipment or service definition reaches into IT and lab ops. Procurement alone won't find it.
So this is a cross-functional project. You need legal, procurement, lab ops, IT, security, enterprise risk.
Yes, and, this matters, you need an executive sponsor who can force decisions when there's trade-offs.
Like, do we dual source this platform and pay more? Or do we accept the risk and potentially lose federal eligibility later?
Exactly.
Okay, let's talk governance. Because boards don't want a 60-page memo. They want the 2 questions that matter.
Right. The first board question is, what portion of our strategy assumes continued access to U.S. federal dollars, directly or indirectly? The second is, which dependencies could cause us to lose that access if designation happens?
And the hidden third question is, how fast can we switch if we have to?
Yes, that's the resilience question.
Now, you mentioned data. The Act talks about multi-omic data, and there's this whole concern about foreign access to sensitive biological information. How does that tie to the operational side?
Think of it as 2 intertwined risk narratives. One is supply chain influence, foreign adversaries gaining leverage over critical biotech infrastructure. The other is data access, human multi-omic, genomic, and related data being collected, stored, or transferred in ways that create national security risk.
And that's why the definition includes data storage and transmission, not just physical machines.
Exactly. It's not accidental.
Okay, so if I'm a CISO, I'm thinking vendor access paths, remote support, data residency, encryption, identity management, all of that becomes part of biosecurity.
Yes. And if you're an enterprise risk leader, you should treat this like a convergence risk: regulatory, plus supply chain, plus cyber, plus data governance.
Let's do a myths versus reality moment. Myth: we don't sell to the government, so we're fine.
Reality: you might take federal research funding, or your partner might, or your customer might be a prime that flows down requirements, or you might need a government channel for pricing or reimbursement-related arrangements in healthcare contexts.
Myth: we'll just wait for the FAR rule.
Reality: if you wait for the FAR rule, you're already late, because platform switching timelines are long, and partners may require assurances earlier.
Myth: we can just swap vendors quickly.
Reality: in biotech, swap often means revalidation, process transfer, and potentially regulatory rework. That's not a quick procurement event.
Okay, now I want to get into the how it fails part, because listeners learn from failure modes. What does a governance failure look like here?
A classic failure is when responsibility is siloed. Procurement treats it like vendor screening. Legal treats it like a compliance memo. IT treats it like a data security add-on. And nobody owns the end-to-end operational dependency.
So then a designation hits, and everyone points at each other.
Yes, and the organization discovers it can't answer basic questions quickly, like which programs use this vendor, or which data flows touch their environment.
And meanwhile, the customer is asking for certifications and representations, and you can't confidently sign.
Exactly. That becomes a revenue risk and a reputational risk.
Okay, let's talk about the law's shock absorbers. There are waivers, exceptions, and some transition concepts, right?
Yes, there are exceptions for certain intelligence activities, certain overseas healthcare services for covered U.S. personnel, certain public commercial multi-omic data situations, and public health emergencies. There's also waiver authority, time-limited, with oversight, and there's a transition approach tied to pre-existing contracts and a multi-year runway.
But the phrase I always worry about is subject to guidance, because that means the real-world usability of those mechanisms will depend on how agencies implement them.
That's right. A waiver that exists on paper may be hard to get in practice, or may come with conditions that don't work operationally.
So you can't build your whole strategy on, we'll get a waiver.
You shouldn't. Waivers are for edge cases, not business as usual.
Okay, I want to do something more concrete. Let's imagine a mid-sized biotech company. They have one government-funded collaboration, and they also want to grow into federal contracts. They use a mix of vendors, some for lab instruments, some for data analytics, some for outsourced manufacturing. What's the first step?
First step, build a simple dependency map that connects the federally relevant work to the underlying biotech equipment and services. Don't try to boil the ocean. Start with the programs that have federal dollars in the chain.
And then rank the dependencies by switching cost and lead time.
Yes. If something takes 2 years to switch, it goes to the top of the risk register.
Then contract changes?
Yes. For those critical vendors, you want contract language that protects you. Designation-triggered notice, termination rights, transition support, technology transfer where relevant, data access controls, and audit rights where feasible.
Okay, now I'm going to push you. What about the vendors that refuse? Because some big providers will say, we're not changing our terms for you.
That happens. Then you have an explicit risk decision. You either accept dependency risk, or you invest in alternatives, or you architect redundancy.
Which is a board-level decision, not a procurement-level decision.
Right, because it affects strategy and resilience.
Let's talk about knowledge. There's this concept that agencies can't contract with entities that know performance will require use of restricted equipment or services. How does that change compliance?
It's meaningful. The threshold is not, you should have known, in the same way some regimes operate. But, this is important, companies shouldn't interpret that as permission to stay ignorant. Contract clauses and compliance expectations can effectively raise the standard through representations and internal controls.
So even if the statute says no's, the market may require you to demonstrate you did reasonable diligence.
Exactly. In practice, you'll be expected to have a defensible process.
All right, now let's zoom out. What is the broader trend here? Because BIOSECURE doesn't exist in isolation.
It's part of a broader pattern. Governments treating certain technology sectors, biotech, data, AI, critical manufacturing, as national security terrain. The policy tool is increasingly procurement restrictions, funding conditions, data transfer constraints, and investment screening.
So in the old world, national security regulation was mostly defense contractors and export controls. In the new world, it's everyone with data and advanced tech.
Yes, especially anyone touching sensitive data sets or critical supply chains.
And that means risk leaders need to stop treating these as special legal issues and start treating them as operational resilience issues.
Exactly. Governance, supply chain strategy, data architecture.
Okay, I want to give listeners some strong statements they can repeat internally, like the kind of line that cuts through noise.
Here's one. If your business model assumes federal dollars, your vendor list is now a strategic asset and a strategic liability.
Oof, that's a good one.
Another, compliance is not a document, it's the ability to switch.
Yes, and here's mine. If you can't map where your biological data flows, you don't have a biosecurity program. You have a hope.
That's blunt, but accurate.
All right, one more operational angle, M&A and partnerships. How does this change diligence?
It adds a new diligence layer, biotech platform and service dependencies, and designation risk of key counterparties. It's not enough to ask, are you on a restricted party list? You ask, could any of your critical suppliers become designated? What's your switching plan? What contract protections do you have?
So buyers will price this risk.
Yes, or require remediation pre-close. or put it into reps and warranties with indemnities.
Okay, let's talk about the research ecosystem. Universities, hospitals, labs, they often have sprawling procurement, decentralized purchasing, shadow IT. How do they even start?
They start by focusing on federally funded programs and high-sensitivity data, create centralized visibility for high-risk categories, sequencing, multi-omic data platforms, managed bioinformatics, and any vendor with remote access into lab systems.
And they probably need policy changes, approved vendor lists, contract templates, and a governance committee.
Yes, without governance, decentralization will defeat compliance.
Now, what about the healthcare access piece? There's language meant to avoid collateral impacts on drug pricing and access, because otherwise you could get weird knock-on effects.
Right. The law includes a mechanism to prevent a manufacturer from losing eligibility for certain federal healthcare program arrangements solely because they can't maintain a particular government schedule contract due to these restrictions, assuming they would otherwise comply. It's basically acknowledging that procurement restrictions shouldn't accidentally destabilize drug access.
So they learned from the feedback loop. You can't break the reimbursement ecosystem by accident.
Exactly. It's a sign the policymakers recognized second-order effects.
But operationally, pharma companies still need to manage the underlying vendor dependency, because the restriction can still block certain contracting pathways.
Yes.
All right, I want to shift to leadership takeaways. If you're a CEO, what's the posture? Panic, wait and see, or something else?
Not panic, but also not wait and see. The posture is build optionality, build visibility, build contractual leverage, and run scenarios.
So, calm urgency.
Yes, calm urgency.
And if you're a board chair or audit committee chair, what do you ask for at the next meeting?
Ask for a short briefing, 10 slides, not 50, covering 1. Your federal exposure, direct and indirect. 2. Your top biotech platform dependencies. 3. Your data pathways for sensitive biological data. 4. Your switching timelines. And 5. The current state of your contract protections and monitoring.
And then ask, who owns it?
Exactly. Ownership is everything.
Okay, before we close, let's do a forward-looking reflection. How do you think this evolves?
I think we'll see more sector-specific controls that look like this. Designation-driven, procurement-driven, data-driven. And we'll see convergence. Data rules, supply chain rules, investment rules.
So the organizations that win are the ones that treat compliance as an operating capability.
Yes, the winners build systems, inventory, monitoring, contracts, resilience.
And the losers treat it as a memo.
Exactly.
All right, let's land it. Give me a natural recap, Matt style.
So, here's the thing. BioSecure is not just a government contracting rule. It's a framework that will, over time, condition access to federal dollars on your biotech supplier and data ecosystem. The definition of equipment and services is broad, the designation mechanism is dynamic, and the operational lead times in biotech are long. So, the smart move is to map exposure, prioritize dependencies by switching difficulty, build contract protections, and set up monitoring. Now, while you still have runway.
And from my side, if you're listening and thinking, this sounds like a legal problem, just remember, legal can interpret it, but operations has to live it. If you don't know your dependencies, you don't have a strategy. And if you don't have a switching plan, you don't have resilience.
Well said.
All right, that's it for today. If you want to share this episode with someone, send it to your head of procurement, your CISO, and, honestly, your audit committee chair. Because this is one of those topics that starts as compliance and ends up as strategy.
We'll see you next time.